Constance University in Germany. So he's joined from Germany all the way. He's also now mainly coordinating research on homotherapy in many universities, colleges, and research institutes in India and abroad. He's published several papers on scientific aspects of Agnihotra and homotherapy, and he's also the president of German Association of Homotherapy. He's also a certified homotherapy teacher. We are also joined by some of our distinguished panelists, Dr. Poonam from Palampur, Dr. Ishwar from Nangal. We will hopefully be joined by Dr. Alex. He is presumably involved in another webinar. So I will now request Dr. Ulrich to come now. He was a panel discussion last time and we had great discussion. He volunteered to give a comprehensive presentation on different aspects of Agnihotra and homotherapy during COVID times. Welcome, Dr. Ulrich. Please start the presentation.
Okay, Dr. Akshay, thanks a lot for inviting me again. So today I will talk about different aspects of Agnihotra and homotherapy during COVID times, but I will, as the time is limited to 20 minutes, mainly concentrate on COVID-19. So the question is, how can Agnihotra help with this COVID-19 illness, which is now spreading all over? So today, everybody is affected by this worldwide. And many countries are still in a state of lockdown. And I think in India, it's still quite severe in some parts at least. And even after this first wave of infection is over, we will still be aware of that danger. And so this question is very important. How can we protect ourselves and our families? And so the question is, can Agnihotra help? There are two recent findings which show that COVID-19 is more severe and deadly in regions with high air pollution. And second, this coronavirus can be transported by particles of air pollution. And if you look at these two findings, then you look at what Agnihotra does. Agnihotra purifies the atmosphere. And several scientific studies have shown that. So if Agnihotra purifies the atmosphere, then it's logical to conclude that Agnihotra can also be a useful tool to combat this coronavirus. We have not done studies yet. We are encouraging scientists to do severe studies on that, but what we have is some preliminary result which makes it likely that Agnihotra can help in different ways. What could be the ways? There are three different possibilities how Agnihotra could help. First is Agnihotra can help to reduce the probability of getting infected. Second, Agnihotra reduces pre-existing conditions, thus leading to a less severe cause of COVID-19. And third, Agnihotra supports the body's immune system, and so the body will be stronger to overcome the infection. Let's look at point number one, reducing the probability of getting infected. We have one report from one lady in Spain. She lives in Madrid. At that time, it was maybe 1 month ago. At that time, Madrid was one of the hotspots in Europe of COVID-19 infection. She lived in a small house together with her husband and one more person. And that third person got infected and got tested positive for the coronavirus. So she and her husband were a little bit scared, so they got tested also. And the test was negative. And the doctor said that is nearly impossible. If you live together with somebody so closely, they shared the same bathroom, they shared the kitchen, they had meals together, then they said it's nearly impossible not to get infected. So it seems she and her husband, they were performing Agnihotra, that they got protected from that. How is such a protection possible? Let's look at the ways how this virus is transmitted. It seems there are three routes, main routes of transmission. First is if you touch surfaces like door handles and so on, which an infected person has touched before. Because this virus stays on such surfaces for some time, couple of hours, they say. Um, but more important ways of transmission seems to be number B, that respiratory droplets of air created by infected people, for example, when they sneeze or cough, and these droplets stay in the air for a couple of minutes. And if then you inhale air and you inhale some of these droplets, or these droplets enter your eyes, then you can get infected. But these droplets normally stay in the air for only a few minutes. So that is why it is good to keep a distance to people, and that helps for less infection risk. Number 3 is mini droplets. They remain in the air for several hours, and these mini droplets, they are created even when people speak. So if you have a conversation with somebody who is infected, you could, these mini droplets could enter your system and you could get infected. Transmission by touching surfaces, that is, according to later studies in Germany, the least probable way, because normally these surfaces, some viruses are there on these surfaces, they are there for a couple of hours, but it seems they are no longer active. So that may be not the most probable way of getting infected. So it's more about the air. And so about the air, we have seen in different experiments. And one such experiment was done by Dr. Poonam, who is here in the panel at the Palampur Agriculture University. And they could show that if you perform Agnihotra, then the number of pathogenic bacteria is reduced. We do not know, that is, we do not have confirmation by some experiment whether viruses also are reduced, but it's most likely because both bacteria and viruses, they seem to travel on particles in the air. So if these particles are reduced in the air, then both viruses and bacteria, they are gone. And now let's look at particles. We have seen some research done at North Maharashtra University in Jalgaon some time ago, and they examined not biological air pollution, but chemical and physical air pollution. Chemical, SOx and NOx, and physical air pollution is particulate matter. And they could show that, you know, after Agnihotra, there's a slight increase in particulate matter because we have some smoke. But then after that, you know, the levels all go down. SOx, NOx, and particulate matter all go down by approximately 30 to 40%. And that was just by doing Agnihotra once. So then if you would do it continuously, this effect would be even larger. Here you see the reduction of microbial count before Agnihotra, after Agnihotra. So that is one thing, reduction of microbial pollution in the air. And another experiment was done in some college in Pune and Ferguson College that showed that the virulence of bacteria is reduced. That means capsule formation, hemolytic activity, and pigment formation all are reduced, which leads to a less virulent activity of bacteria. This same thing has not been done for viruses, but there's some good chance that also it would apply to viruses. Here you see the details of reduction of virulence. One more thing is Agnihotra ash works on multi-drug resistant bacteria, which do not get affected by antibiotics anymore. This experiment was done in Kathmandu, at the Kathmandu University, and just adding Agnihotra ash these multi-track resistant E. coli bacteria, they got reduced a lot. You see the photo here, and here you see from 2,400, after 5 days, it came down to 3, after 3 days to 210, whereas the control was still the same number, 2,400. So that was one point which states that the risk of getting infected is less. Second point, reducing pre-existing conditions. We know that most people who have died from COVID-19 and those who have a severe illness of COVID-19, they had some pre-existing conditions like heart disease, high blood pressure, asthma, emphysema, chronic bronchitis, diabetes, cancer, and immune system deficiency. Agnihotra helps with all these different pre-existing conditions to either reduce them or people could get rid of them altogether. Some example, high blood pressure or low blood pressure. This experiment was done with a number of persons, and the blood pressure was measured before Agnihotra and after Agnihotra. And you see, those with high blood pressure came down. Those with low blood pressure came up. So Agnihotra helps to regulate the blood pressure, means one of the pre-existing conditions for a severe cause of COVID-19 is done. Same thing with heart disease, with asthma. Asthma very important because COVID-19 first affects the lungs. So if you have any lung disease, you're more prone to get severely affected by that. So asthma could be cured, another case of asthma. Diabetes, that was a farmer in Unnao area between Lucknow and Kanpur. His blood sugar level was more than 300. It came down to less than 200 by just him performing Agnihotra. He was performing Agnihotra not because of self, but because he was doing organic farming. So he has to do it for his plants. And as a side effect, the blood pressure, blood sugar level came down. And now it is even more than that, came down to a very normal level. Some types of cancer were healed. Again, lung tumor and immune system. There are so many people who got healed from all kinds of different diseases with Agnihotra and Agnihotra ash. So that strongly indicates that the immune system of people gets stronger with the help of Agnihotra and Agnihotra ash. And the immune system is most important in case of a virus infection because you do not have a direct medicine. Another of these pre-existing conditions is stress and anxiety relief, because if you are stressed, then you are more prone to any disease. And if you can relieve the stress, then that helps a lot. There were experiments done. One was in Moscow, Russia, and you see people were tested before they started an Agnihotra. They did Agnihotra for 2 weeks. And before, you see at the left side, these red bars show anxiety before, and then the white bars, anxiety after. The black bars, depression before, the green bars, depression after. And you see all these values go considerably down. About stress, some controlled study has been done in Chile, in Santiago de Chile. It's a medical university. And there, that was before some very difficult test, and all students were highly stressed. So the researchers took 24 of the most stressed students, formed two groups, 12 people each, and then they invited these two groups to some Tai Chi lesson and told them, okay, this Tai Chi will help you to relieve the stress. And what these students did not know, for one of the groups, when they had Tai Chi, Agnihotra was performed in the room next to them. So they didn't see Agnihotra, they didn't know. So it was a blind study. And you see, before the intervention, before the Tai Chi, 100% of the students were extremely or severely stressed. After Tai Chi, after just Tai Chi, that came down to 41%. But after Tai Chi, where Agnihotra was performed next room, it came down to 8.4%. Also, they tested the level of cortisol in the saliva, and before, the students in the Tai Chi group had 30.6 nanogram per milliliter, and Tai Chi reduced to 22%. The group where Agnihotra was performed, before it was 28.9 nanogram per milliliter, and after the intervention with Tai Chi and Agnihotra went down to 17%. You see a clear difference in the reduction between these two groups. Now, this is an experiment was done in Moscow again by some doctor of medicine, and he measured the brain waves with EEG before Agnihotra and after Agnihotra. Here you see the biggest part is beta waves, the green part, beta waves, 70%. Beta is beta waves you have when you are active, but also when you are stressed. And alpha waves, the blue area, is more shows more relaxation, and the yellow part, that is meditation level, that was pretty small here. So here, let us look at beta. Before Agnihotra, it was 70%. Now after Agnihotra, it was only 22%, but alpha waves, the waves of relaxation, they came down, they came up from approximately 20% to 57% approximately. Now PowerPoint does not react anymore. I'm very sorry.
Just try a little bit and we can just pause for a moment and maybe it will resume. Maybe you can just explain from your memory.
Okay.
Okay.
I mean, I'm very sorry. PowerPoint, I had to kill it, but until I open again, it will take some time. So this is what we've seen. The pre-existing conditions, they get reduced, which means that in case you still get it, then the COVID-19 would probably take a less severe course. So you would probably just have it like a normal flu. Now, there were more tests done on the virus itself. First thing, there was some studies done on the on some type of coronavirus, but not the SARS coronavirus 2, which is responsible for this COVID-19 disease. Some other types of coronaviruses which were there before. And What they did is, because you cannot, that was an experiment in a cell line, and you cannot add Agnihotra ash directly to a cell line, because everything what you add, it has to be filtered. And so what they did is they added Agnihotra ash to water. They kept it there for 24 hours. And after 24 hours, they sieved it so that ash particles were no longer present there in the water. And this they inserted in the cell lines, and that led to a reduction of these coronaviruses of 50%. Now, you could say 50% is not so much, because if you do with chemicals, normally you just kill things. But still, if you have a 50% reduction in growth or multiplication of this coronavirus, it may be the difference between a very mild cause of the disease and a severe cause of the disease, or even between something which you don't even realize and a mild cause of disease. So that still can be can make a big difference in how the disease actually proceeds. Another thing was an experiment we did with HIV. There were children in some home in Mysore, HIV positive children, and they of course had very difficult health problems. Also normal health, like getting infection and so on, they were very much prone to that. And then I was invited there, and these children started to perform Agnihotra. They performed Agnihotra themselves. So each child had his or her own pyramid. They're performing Agnihotra, and there was a considerable reduction in the viral load after 1 year, and also the immune system was much improved. So all these normal small diseases which often have, like infection, cold, whatever, that did not happen anymore. The doctor who was taking care of these children told me that before that, he was often called, regularly called in the night, because one of the children had some problems, some cold, some whatever. And after they started with Agnihotra, that did not happen anymore. Now, HIV is also a virus disease, so that leads to the assumption that, because now here we also have to do with the virus, that also that could be helped with Agnihotra. Of course, some study has to be done, so I encourage everybody who listens to that, who works in this field, to contact me so that some study could be done. Would be good to do a study. Best would be to do a study in a hospital where we have the patients, COVID-19 patients, and to see what happens if you perform Agnihotra in this hospital morning, evening, regularly, and also give Agnihotra ash to the patients regularly, and to see the difference you can compare with other hospitals where you don't perform Agnihotra. Also, you could do a test on this novel coronavirus in cell lines by adding Agnihotra ash water. And then, very important to see in some hospital with corona patients, to measure the load of these viruses in the air, and then perform Agnihotra, and then measure again. Similar to the experiment which was, for example, done by Dr. Poonam with bacteria. Only thing, do that with viruses. See whether the reduction is there in the same way like we had it with bacteria or with fungi. One more important point is now these health professionals nurses and doctors, they are much affected by this COVID-19, and many of them have died in all the different countries. So Agnihotra would also be a very good support to them, because we should help them because they're helping others and even risk their own life to help others. So that would be a very good support for them also. Okay, my time is over. I'm sorry that PowerPoint failed in the middle, but still, I think you got some of the points. Thanks a lot again, Professor Akshay, for inviting me and giving me the chance to talk about the possibility of Agnihotra, how it can help in the case of COVID-19. Thank you.
Thank you, Dr. Burke, for a very compelling and evidence-based presentation. I am really surprised that a lot of data that you presented doesn't come to be visible in the mainline journals like Journal of Internal Medicine or Journal of Biological Chemistry, Annals of Neurosciences, and which is why we started the entire concept of integrative medicine case reports, where we can integrate and publish reports that are outside the domain of the modern medicine or the mainline medicine. And when we started doing these lockdown series since last 80 days on behalf of this journal, we came to know a lot of therapies that are beyond the understanding of modern medicine. And thanks to this platform, thanks to you, Dr. Ishwar, Dr. Poonam, I can see Dr. Rakesh Panditji has also joined. Thanks to all of you who are working in close collaboration with the modern medicine. But we really need journals, integrative medicine, so that when these reports appear in the pages of physicians' journals, that is when what you just now visualized, that this should be done in a hospital, will be possible. So that was a very good piece of data and I would say commentary, ranging from microbiology experiments and some EEG experiments. Your slides were fine, so we had enough slides and we have enough material to discuss this on this forum. I will briefly introduce you to all the distinguished panelists, starting from Dr. Rakesh Pandit, who is a person of eminence from the world of herbal medicine, medicinal plants from Ayurveda. He's also the member of the national board for an NGO called Arogya Bharati, aiming to have a disease-free India. He's one of the members of the national committee which steers the strategies in our country. Welcome, Dr. Rakesh Pandit. We are also joined by Dr. Ishwar, who in fact was the first person who, in our forum at least, where Dr. Burke was a panelist when he spoke about Agnihotra. And I could see some comments on Agnihotra asking, what is Agnihotra? Then I just typed quickly, it is a sort of Havan. So people were not even aware of this. So thank you, Dr. Ishwar. You are joined from Nangal. He's an Ayurveda Acharya. He's also a syndicate on a couple of Ayurveda universities. And he's an active proponent of Ayurveda. His drugs are under consideration, anti-migraine drugs are under consideration, Ministry of Ayush. And we are also joined by Dr. Poonam from Palampur. She is a principal scientist at Agriculture University in Palampur. Thank you, Dr. Poonam, for joining us. And especially important for you to join because Dr. Burke showed that data that presumably belong to you. So I may have a question for you at the end. But now I keep the panel open. We are on the Facebook Live. And our idea is to enhance the submissions of research papers that empower or increase the visibility of integrative medicine and its application. So unless we have good publications, good data, we will not be able to implement it for the benefit of society, and especially in times when we have untreatable disorders staring at us. So I'll open it to the discussion. And we will have an informal drawing room chat as viewers listen to us. I will keep an eye on the Facebook. If people ask questions, I will also bounce them on this forum. and any of you, including Dr. Burke, can handle them. But before we ask the other panelists to be asked certain questions from the Facebook chat, I would request Dr. Rakesh Pandit to comment or criticize or ask a question pertaining to his presentation. So over to Dr. Rakesh Pandit. Welcome to our forum, Dr. Rakesh. Yes. The others may please mute.
Thank you, Dr. Akshay ji.
Welcome.
Thank you, Dr. Akshay ji, for this wonderful program. I thank Dr. Burke also for presenting a very nice account of Agnihotra and some scientific studies and some data he has presented. I am very happy to see Dr. Poonam ji here because during one conference of Aroge Bharti at Una, she presented a wonderful paper with very authentic data, and most admired presentation was of Dr. Poonam in that conference. Regarding this Agnihotra, in our Vedic literature, we find Agnihotra, Homa, Yagya, Havana, and different kinds of sort of things. But as far as Ayurveda is concerned, Havan, Agnihotra, or Yagya, they are advocated for certain type of disease under the heading of dhupana. Dhupana means fumigation. We burn some herbal medicines, ral, loban, gugulu, neem, leaves, sarson, and clarified butter of desi cow, of Indian cow, and so many other things. When they are burnt in certain ratios, the fumigation which arises